Hi and welcome back to another video of Medic Notes. This video will be on compartment syndrome. This condition is often seen in orthopedics department. It is caused by bleeding or swelling within a muscle compartment. This will cause an increased pressure in a muscle compartment, causing muscle and nerve damage, along with pain. Compartment syndrome can be dangerous or life-threatening if it is left untreated. This is a picture showing the compartments in the leg, where there are 4 of them: the superficial and deep posterior compartment, the anterior, and the lateral compartments. The signs of compartment syndrome are 6p. Pain is felt on passive stretch test. Pallor and poikilothermia, where the limb is pale and cold. Paresthesia, the patient may have numbness or tingling sensation in their lower limbs. Pulselessness, where the distal pulses are absent. Paralysis, when the patient is unable to move their legs. For clinical presentation, symptoms may not appear for 24 hours after injury. Clinical signs include increased pain, even after reduction and casting, severe tenderness over the anterior compartment muscles, rather than fracture site, is an indication of possible compartment syndrome. Irreversible muscle damage may occur after 4 to 6 hours, after which time the pain of the ischemic muscles may have diminished or become absent. On physical examination, we check the blood pressure, as compartment syndrome is potentiated by hypotension. Assess for pain. A characteristic is extreme pain out of proportion to the injury. Pain felt on passive movement of the fingers or toes, and the patient will usually flex the injured part to relax the fascia and reduce pain. Check the pulses such as dorsalis pedis pulse, and compare to opposite limb. Other signs to look for are pallor of extremities, paralysis and paresthesia. For compartment syndrome in anterior compartment, the expected signs are weakness of toe extension, pain on toe flexion, and reduced sensation in first web space. Whereas, for posterior compartment, weakness of toe flexion and ankle inversion, pain on toe extension, reduced sensation over sole. Lastly, the management of compartment syndrome is fasciotomy. Normally, the lateral fasciotomy incision is made halfway between the tibia and fibula. With a difficult fracture reduction, consider making the incision slightly closer to the tibia, so that the fracture site can be palpated, and bone holding clamps can be applied. That's all for this video. Thank you.